Dear friends, I'm Dr. Pradeep Mahajan, a basic surgeon and researcher in stem cell science or biological science at StemRx Bioscience Limited. A small story of a global pandemic. This pandemic is growing and growing and growing and growing. Down the line, it will not be wonderful or difficult. Every family will have diabetes, 1 or 2 patients, which is a metabolic condition having its own complication like retinopathy, nephropathy, neuropathy, vasculopathy, angiopathy, talk of organ which is not given gift to you in damage from diabetes. So it's a disease which is a silent killer for you. Unfortunately, type 1 diabetes is also increasing nowadays in small children. As well, type 3 diabetes is also increasing, which is pancreatic disease, which is also increasing nowadays. StemRx has changed the philosophy of diabetes. At StemRx, we don't define diabetes as a disease. We just define as metabolic irregularity or dysfunction as a first definition, where carb metabolism is dysfunction. At second level, I defined it as failure of your Krebs cycle to maintain the oxyphosphorylation for producing ATPs and burning the glucose. At third level, enzymes from the liver 43 are failed to release to put this cycle Krebs into function. At fifth level, what is beautiful about is that the Krebs cycle only functions when the liver releases certain enzymes, for which pancreas has to synchronize at a given cycle of 3 to 6 minute pulse in an oscillatory fashion. Pulse in a microdose of insulin, which is nanograms, to put these GLUT4 receptors into function as a mechanoreceptor. All is changing in diabetes. Everything is changing. It is not the insulin important. It is neither any other inflammatory process involved. These are all on the process of pathology. But the basic, further to go ahead, I would say failure of turbine of mitochondria. Further to go ahead is a failure of proton gradient to produce ATPs. So we define it into different parts of diabetes. At StemRx, we go at this your proteomic level, genomic level, molecular level. Repair the entire system from molecular level in the mitochondria, which plays a major role to reset the entire function of Krebs cycle. And the beauty of diabetic patients which produce more ROS and less ATPs will be reversed complete into less ROS and multiplied fold of ATPs and mitochondrial biogenesis. Now remember, when we talk about diabetes, the first fear in the mind is my fate is decided. I'll be lifetime insulin. Let me tell you, StemRx has come with a complete word I should not use as a cure, but reversing the complete metabolism. Not only that part, it reverses your pathological processes, insulin resistance, use of glucose, more burning and producing more ATPs, which helps to regenerate entire body. I would say rather, it's not only reversal of diabetes or correcting the metabolic disease of the body, of diabetes, sugar or metabolism of the carb. It's regenerating your whole body. It is the first step for a diabetic patient to go into ageless life, anti-aging. So your first journey will start with StemRx in spite you have a graded, high-grade metabolic disorder and involvement of organs in diabetic complications. This step will start your regeneration, enjoying at 60s, life like 40s, enjoying at 80s, life like 60s. This particular system or protocol designed at StemRx to reverse the entire molecular function of Krebs cycle, that is TCA cycle, reducing ROS and increasing ATPs, will be a gift to all of you who luckily hear my talk today and contact me on the given email address below, as well my mobile number. Those who have any questions, they can send a mail, write a mail, or those who want to personally discuss, they can give a call. All the best for all my diabetic friends to regenerate their life and live younger. Thank you.